Yeah. Hello, friends. I'll just be doing a small snippet on Rezafungin as a part of the newer antifungal agents. So maybe around 3 to 4 minutes. Nothing much new is there in this Rezafungin, but the key aspect of it is it's available in Europe, USA, and in Japan. So I'm told that will be soon available in India as well. So the context for this new antifungal is, as I told already in the previous talk, that we have antifungals for Candida. We have uh, for molds. I think the choices are little limited now. We have more of amphotericin B, and then we have for other resistant fungi we have echinocandins. So these are the three groups. So right now we really are looking at a agent which would encompass all these other fungi, molds, candida, auris, and other sort of a rarer fungal infections like aspergillus also. So because if you have to use an antifungal for aspergillus, we have voriconazole. And if you have to use for Candida auris, we have echinocandins. If it is molds, we have amphotericin B, so on and so forth. So we need some newer agents which can cover most of this. So Rezafungin sort of comes under the armamentarium of echinocandins, as the name suggests, like caspofungins, micafungin, are another. So Rezafungin is one of them. So it appears to be a little derivative of Anidula fungin. So what is Rezafungin? So it is a sort of a modification of Anidula fungin, where one of this hydroxyl group, amiamynyl hydroxyl group, is replaced with a cholinamynyl ether. So what this replacement of this hydroxyl group with a cholinamynyl ether facilitates is that metabolism or hydrolyzing of this anidula fungin is delayed. So metabolism gets delayed and the half-life is significantly prolonged. So the key hallmark of Rezafungin is the half-life is so long that it can be used once in a week dosage. So that is the distinct and a huge advantage because of some changes in this chemical composition of Anidula fungin makes it as a very long-acting sort of a molecule. I think that remains the strength of Rezafungin, and that is where it would be positioned as. So as I said, the half-life is very long, and if you look at the mean half-life after first dose, it's 80 hours. So which means the action of the drug is so long that you can space it once a week. Even the dosing recommendation, if you divide 150 hours divided by 24 hours, it comes to 6.5 days, which means you can space this drug every week. So that's the distinct advantage. And it's already being used in US, Europe, and Japan. So I'm told that in India also it is available in gray market. So very soon it will be made available. And it will be a boon because once a week dosage makes it very easy with regards to the compliance and the usage in long-term sort of a treatment of candidemia and other fungal infections. So as I said, it's a once weekly recommendation. And if you look at mechanism of action, it's very similar to echinocandins. How does echinocandins act? It acts by inhibiting beta-1,3 glucan synthase, which is responsible for the synthesis of beta-1,3 glucan, which is needed for the cell wall. As you see, this is the cell wall of the fungi, and beta-1,3 glucan are the building blocks of the cell wall of fungi. And this synthase, this yellow one you see, helps in the formation of this beta-1,3 glucan. So Rezafungin inhibits. It's like any other echinocandins. It acts by inhibiting beta-1,3 glucan synthase. So very simple. So now we have to contemplate on whether there is any evidence. Obviously, it's a new molecule. It has to go through phase 1, phase 2, and phase 3 trials. So when you look at spectrum of activity, it is little different with regards to echinocandins. So obviously, it has good effect on candida, and like now newer antifungal agents, we expect them to cover for cryptococci. So this has activity against cryptococci. And good thing about this newer fungal, like yesterday I spoke about phosmanogepix. So they have effect on all these other fungi, like even aspergillus. So it has a good effect on aspergillus. It has good effect on trichosporon, and it has good effect on rhodoturola. So these are all the morphological structures of these fungi. So again, as you see, unlike Anidula fungin, caspofungin, they tend to have broader coverage, and the half-life is long, which helps us to space it about a week apart, which gives it a sort of a unique positioning in the armamentarium. So when you look at the dosage is 400 mg IV loading dose followed by 200 mg once weekly. So that is the sort of a dosing. And obviously, there are trials which has looked into the safety. There are two trials. So there is a Strive trial and a Radiant trial. which are phase 2 trials, basically to look into the safety of this Rezafungin, and it has found to be very safe. So that's the beauty of this drug. And they looked into 151 patients in these trials, and they've tried to look at what may be the other adverse events. It does cause hypokalemia, hypomagnesemia, and some febrile response, and they can have some diarrheal symptoms. So these are all sort of side effects of any common drug. So there was nothing sinister sort of a side effects from the Rezafungin. So some metabolic disturbance, vomiting, anemia, and diarrhea. So these were the only sort of a side effect that was seen with the Rezafungin. So this was the STRIVE trial, which actually looked into the safety. So they did in 207 patients in invasive candidiasis, and it was found to be safe. And these authors, Thompson et al. From US and the Spanish group, they went ahead to do the phase 3 trials of the Rezafungin, which I'll show. So the ongoing studies is there is a RESPECT trial, which is in invasive candidiasis. And there are restore trial. Apparently, this is which is hypothesized to do in HIV patients in pneumocystis carinii, where they are comparing Rezafungin with plus trimethoprim sulfamethoxazole versus only trimethoprim sulfamethoxazole to see its effectiveness. There's another restore trial done by the Thompson in candidemia also. So this is the RESPECT trial done by the European. So there are multiple countries in Europe. So there is Belgium, Netherlands, Germany, and others which are doing the role of weekly Rezafungin as a prophylaxis in allogenic blood and marrow transplantation. So the data is not out. So we would be eagerly seeing how effective it has been, because if you see the positioning of Rezafungin, they have looked at allogenic blood and bone marrow transplantation, where the risk of all this exotic fungi is very high. It's not only candidemia, it's about molds, and it is about other resistant candida like Candida auris or aspergillus or pneumocystis for that matter, or cryptococcus. All these are common. So they're looking at positioning this as a prophylaxis. So this RESPECT trial is meant to come. So this trial, the number that they're recruiting is 462 patients. So this is the other trial which I mentioned, which has already come in 2023 by the same authors, Thompson's, where they compared Rezafungin versus caspofungin for treatment of candidemia and invasive. This was a multi-center randomized trial. They looked at 199 patients, and they found Rezafungin is non-inferior to caspofungin with regards to its effectiveness in invasive candidiasis. So this is a group which has done phase 2 trial, and they've done restore trial, and there's another trial that they would be embarking is in HIV patients, comparing Rezafungin with trimethoprim sulfamethoxazole versus only sulfamethoxazole trimethoprim in pneumocystis jirovecii infection. So this is all the data we have at this point of time. So the key take home is Rezafungin is very similar to echinocandins, and it is a derivative of anidulafungin with the change in the chemical structuring, which leads to prolonged half-life. So the only thing that you have to remember is it is once a week dosage. So 400 mg as a bolus and 200 mg once a week. And if you look at the safety trial from the Radiant trial and the other trial that was done, it was considered safe except hypokalemia, hypomagnesemia, febrile response, diarrhea, vomiting. And the awaited trials are these two trials, RESPECT and the Restore in HIV patients. Apart from this, there's nothing more to talk on this molecule. So it is currently being used almost since 5 years in US, Europe, and Japan. So pretty soon we are told it will be available in India. So that's about it, folks. So thank you very much. Request you all to submit valuable work to Journal of Acute Care. So you can visit my website to rehead to discuss it. Thank you.